warm greeting to one and all present here. Okay, before I was asked to give a lecture to all guys by Dhanlakshmi ma'am. She is not here, I think, and I am very humble and I will be very thankful for her because I got a new mother here. So, what's your name, ma'am? My name? Thanks so much. I got a new mother at JMC. Okay. A small glimpse about me. I am Dr. Madhu Balan, resident medical officer at Aishwarya, and also I am managing two clinics at my native place and in one in city. And I have two pharmacies and one nursery and primary school at Alumni. So, I feel very privileged to give lecture about the topic One Liver, One Life in the historically significant college. I am very happy to see you all. I am looking forward for a very interactive session. நீங்கள் நான் மட்டும் பேச போகிறதில்ல, உங்ககிட்ட இருந்தும் இன்புட் நான் எதிர்பார்க்குறேன். Let me all discuss about this thing. Okay. Do you know what special today? Anyone? What special? Of course, World Hepatitis B. Anything else? Okay, apart from World Hepatitis B, today is Dr. Boris Blumberg's birthday. He is the one who discovered hepatitis B, and he is the first one to discover vaccination for hepatitis B. So, for every July 28 on this birthday, we celebrate Global World Hepatitis Day in honor of his birthday. So, he was very curious about the hereditary transmission of diseases through blood. Accidentally, he was seeing some peculiar protein coming from mother to baby. When he do more research on that, he found out that the spikes and protein exhibited in his research was none other than a virus. He was very shocked to discover that, and he developed the vaccine, and for good Lord, we have a vaccine for that, because the hepatitis B virus is very deadly. And he got Nobel Prize in 1976 for his work. Okay, why do we have World Hepatitis Day? Why don't we have World Cold Day, World Cough Day? World Hepatitis Day we have because nearly 354 million people were currently affected by hepatitis, and it was curable, and yet people die from that. Hepatitis B remains a significant public health concern in India. Nearly 40 million people, 40 lakhs people are infected by hepatitis B, and they were admitted in hospitals in very late stages. I will come to the point why they are coming very late to hospital, and the reason why we should celebrate World Hepatitis Day, or why we should observe World Hepatitis Day, or anything of a peculiar disease or something, because we want to spread the awareness. Not only awareness, we urge the people to go for a testing, and we educate the people so they will not get the diseases. So it was a preventive measure also, and we will establish the treatment in a very early stage. So by giving a simple awareness, like here in JMC, some patient in future from you, by your consent, may get treated in early stage. I hope so. WHO said hepatitis can't wait. It was their slogan. Usually they won't give slogans in imperative ways. Imperative ways in like we are fed up of something, and they want to order something in a very imperative state. So they are saying, World Health Organization are saying, hepatitis can't wait. Because it was a global crisis. They observed that so many developed countries and developing countries are undergoing this crisis. So they joined the global community together to eliminate viral hepatitis as a public threat by 2030. They set a goal. WHO also identified hepatitis B virus and C virus infection as a public health problems. Okay, before we go into the viral hepatitis and lectures, what is hepatitis? Anyone before you come to the house? Anyone Google it? Anyone of you? Okay, so first and foremost, I have a quiz at the end of the session. Only one question I will ask. Those who answer will get 500 rupees from me. Okay, so please be alert. Okay, so anyone Google it before you come into the lecture hall? I know everyone have phone, right? Does anyone don't have phone? Very good. That's it. Correct. Hepatitis is nothing but inflammation of liver tissues. Like someone beat you, you will get redness, swelling in cheeks. It will cause pain. The same will cause inside the body. Liver is where? It is inside the body. So it will get inflamed, it will get redness, it will get swelling, it will cause severe pain. So it is nothing but inflammation of liver. It may cause death. It may cause death. If not brings to medical attention earlier. So we are going into the viral hepatitis. Before we go, how many viruses are there causing hepatitis? Any guesses? How many? Number? Just count the number. 4. Okay. Good guess. Anyone else? 4, 6, 7. Okay. 9. Not more than 9. Okay. Okay. Let's see. Okay. Let's see. We have hepatitis A virus, right? We have hepatitis. Next one, B virus. We have hepatitis. We have hepatitis. We have hepatitis. We have hepatitis. No, we don't have hepatitis F virus. We have only 5 virus. Okay? We only have 5 virus which causes hepatitis. We also have one G virus which won't cause hepatitis to human. It only causes hepatitis to pigs and wild animals. So I don't mention here because we are all humans, right? Okay. Any doubt on that? Let's see hepatitis A. Hepatitis A is known as infectious hepatitis and epidemic jaundice formerly. கொஞ்ச காலத்துக்கு முன்னாடி ஒரு 30-40 வருஷத்துக்கு முன்னாடி அது வந்து ஒரு இன்ஃபெக்ஷியஸ் ஹெப்பாடைட்டிஸ்னும் எபிடமிக் ஜாண்டிஸ்னும் சொல்லுவாங்க. ஏன் அப்படிங்கிறது அடுத்த ஸ்லைடில் நான் சொல்கிறேன். இட் வில் காஸ் அக்யூட் இன்ஃபெக்ஷியஸ் டிசீஸ். அக்யூட் இன்ஃபெக்ஷியஸ் டிசீஸ்னா அக்யூட்னா சடன். இந்த வைரஸ் வந்த உடனே சடனாக சேஞ்சஸ் நம்ம பாடியில் தெரியும். அந்த என்ன மாதிரினா ஃபீவர், ஹெட்டேக், யூ கேன் சி அப்ரோச் fever, headache, generalized weakness. Anorexia. What is anorexia? Pasirika. Pasirika. I think most of the girls don't eat food, right? Anorexia. Hey, it's one of the symptoms of hepatitis. Okay. Nausea, vomiting, and like after 2-3 weeks, it will cause dark urine and jaundice. What is jaundice? Manjalama. கண்ணு மஞ்சள் ஆகுது, ஸ்கின்னு மஞ்சள் ஆகுது. ஓகே, ஸோ இது ஏன் எபிடமிக்னா ஒரு குறிப்பிட்ட ஏரியாவுக்குள்ளார திடீர்னு அவுட் பிரேக் ஆகுது. COVID-19 எப்படி வேர்ல்டு ஃபுல்லாக அவுட் பிரேக் ஆச்சு, பேண்டமிக்னு சொல்லுவோம். வேர்ல்டு ஃபுல்லாக போச்சுன்னா அது பேண்டமிக். ஒரு குறிப்பிட்ட ஜியாகிரபிக்கல் லொக்கேஷனுக்குள்ளார மட்டும் அவுட் பிரேக் ஆச்சுன்னா அது வந்து எபிடமிக் சொல்லுவோம். எப்போ எபிடமிக்னா ஒரு திடீர்னு ஒரு மழை வரலாறு காணாத மழை சொல்கிறாங்க, அந்த மாதிரி ஒரு மழை வருது. அப்படி வரும்போது எல்லா இடமும் நிரம்பும் நம்ம வீட்டுக்கு தண்ணி வரும், குடிக்கிறதுல மழை தண்ணி கலக்கணும், நமக்கே தெரியாமல் அதை யூஸ் பண்ணுவோம். ஸோ இது அதனால எபிடமிக் ஜாண்டிஸ். அண்ட் தென் அடுத்த ஸ்லைட் பாருங்க, ஏன் எபிடமிக் ஜாண்டிஸ். யூ கேன் see two gentlemen who is preparing your delicious pani puri. You are planning to eat that after the lecture, right? They are preparing the delicious snacks. The one what he is doing, the first one you can approach what he is doing in the break, and the second one he use his hand as a spoon and later he will lick. Okay, so this is how hepatitis A is transmitted. The mode of transmission is fecal-oral. Fecal is stools. Stools should go in toilet then drainage. That where stools is there. Then how come we are supposed to drink the supposed to contaminated water? Fecal-oral இருக்கு, அது எப்படி வாட்டர், ஃபுட்டு, மில்க் இதெல்லாம் கண்டாமினேட் ஆகுதுன்னா ஃபர்ஸ்ட் ஜென்டல்மேன் எக்ஸ்பிளைன் திஸ். முதல்ல இருக்க பிக்சரை பார்த்தீங்கனாலே fecal-oral எப்படி வருது நமக்கு அப்படின்னு தெரியும். He simply will do the second process. First he will do that process, and second he will use his hand as spoon, and the third what he will do? Yummy, he will eat. We eat and say yummy, and we will post snap. Okay. And after 1 week we will get hepatitis A. This type of hepatitis A will come to epidemic when drinking water mixed with drainage water. ரீசெண்டாக ஒரு 3-4 monthsக்கு முன்னாடி வரையூரில் ஒரு இன்சிடென்ட். யாராச்சும் வரையூர்லேருந்து வருங்களா? வரையூர்லேருந்து வந்தீங்கன்னா உங்களுக்கு தெரியும். வரையூரில் ஒரு இன்சிடென்ட் நடந்துச்சு. Many of the people got cholera and some of the people got hepatitis. They were admitted in GH and they were admitted in HDU and IMCU. Nothing but ICU. The reason is why the worrying people only got hepatitis and cholera because the drinking water was mixed with drainage water. People were unaware of that. They didn't care to boil the water, so they didn't drink directly from the tap. So they got all the viruses and bacteria. Okay, before you go to the snacks, let know your taste bud that how it was made. Always select hygiene places. I am not against street food. Occasionally I will also eat street food. Okay. These viruses will use human as a reservoir. It will stay inside the human. It will eat. It will get nourishment from inside the human, and yet it will cause disease to the human. Such a parasitic behavior, right? Okay. You can approach the period of infectivity usually 2 weeks to 2 weeks total incubation period, and 1 week from the onset of jaundice. Infective materials mainly human feces only. Virus excretion is through feces only. These kind of viruses mainly affect children. You all should know why mainly affect children, because they fond of eating everywhere, anything. Okay, so it also affects adults who didn't bother about hygiene, and it affects equal male and female. So immunity will last once you got a hepatitis A. Now there are so many strains, but once you got one strain of hepatitis A virus, you will be immune for your whole life. So unless other strain will cause something in you. As I speak, it is associated with heavy rainfall Prevention, hygiene measure, it has vaccine. I don't know, have you been heard of Hepatitis vaccine, but every healthcare worker got this vaccine, including me. Let's come to the notorious virus in all five. This is a rowdy virus, may cause death and cause cancer if untreated. If we untreat this virus, this is totally treatable. Patient don't know that they got hepatitis B virus at the first point, and they will come at late stages. It will cause death and cancer. The major hepatocellular carcinoma is caused by this type of virus, and other factors too contributes to hepatocellular carcinoma. Okay, formerly serum hepatitis. When Dr. Bulger discovered this virus, he only discovered from blood. The other name of blood is serum. It is a serum hepatitis. It acute systemic infection is major pathological changes in liver. This term is a medical term. I will say that pathological changes is major changes in function and in structure. It will give changes in liver after infection. Endemic throughout the world, especially in tropical and developing country. What we are we dry country? Are we developed country? What we are? What is India? It is in the tropical region. It is a developed or developing? Developing country. So, surely this is a crisis in India. That's why when you are born, I think you are a 2K, right? 2K kids, right? Yeah, yes, I think so. Okay, you might be 2K kids, but that why I am asking, why I am saying that you are 2K kids means you all are immunized against this virus. When you are born, the nurse who took you and the nurse patted you, cleaned you, and what she will do? She brought an injection and loaded the vaccine and put in your thigh, and you will cry very louder. So that's how everyone got that jab. So symptoms is vague symptoms only. Initially, it won't cause any symptoms. It's like right abdomen pain I have, like the symptoms patient will tell. It will cause jaundice later on and vomiting. And this is structure of hepatitis B. That I think zoology students are present, right? Zoology students are present, right? Biotech also present. So you are quite aware of the viral structures, protein, caspid, and everything, right? No? No or yes? Just say yes. I won't ask any question about it. Okay. So in the center, you can see a spiral structures like a lily structure, like lily poo, water lily poo. That structure is a DNA. When you got the DNA out, it was a tail vaccine. It will become tail vaccine. That protein outside, there are orange things present. Outside is a protein, and the protein also our immune system identify. The hepatitis B, the hepatitis C. Next time on the study So that how vaccines are manufactured. Reservoir is not men, also women are the reservoir. Why particularly here stated as men? Any guesses? Any wild guesses? Just a guess. ஏன் மென்ன மட்டும் வந்து ரிசர்வ் ஆயில் அப்படின்ற மாதிரி போட்டிருக்காங்க? சொல்லுங்க. அவங்க தான் நிறைய இடத்துக்கு போகிறாங்க, ஊர் சுற்றுறாங்க, நிறைய இடத்துல சாப்பிட்றாங்க. That was a very good guess. That same with addiction. It's not alcohol, it is a drug abuse. People will inject themselves drug with syringe. They have அது வந்து தனியாக பண்ண மாட்டாங்க, கூடவே ஒரு ஃப்ரெண்டை வச்சு தான் பண்ணுவாங்க. That friend didn't care to buy a simple syringe which cost 1 rupees only. He will inject first and then he will give the same syringe to the person. So, if that A person got hepatitis, his blood is on the syringe, that needle. When the B person, which let's say he don't have hepatitis, he will get hepatitis by sharing the needle. So this peculiar behavior is prevalent among men, not in India, but Western countries also females are doing this kind of drug abuse. But talking in about India, men are very prevalent to get Hep B. So say like both are carrier and reservoir. Infective material, what are the source we get from B? Ever wonder that where the COVID virus is coming from? If somebody is sneezing, you run to your home. If somebody is sneezing, during pandemic, we all wear a mask, right? We all wore a mask. Afterwards, they opened colleges and every cinema gatherings and everything was step by step. They opened with partial occupants. Ever any one of you feared that very next to you someone made a cough and sneeze? That might be a COVID and you ran from there. யாருக்காச்சும் அந்த அனுபவம் உண்டா? பக்கத்தில் இருக்கவங்க தும்முனது இருந்தது அவங்க கோவிட் இருக்குமோ சொல்லி நான் ஓடினது. I have that experience. That's why I am asking. So it was very funny. Here, blood is the main source. Viruses also have been found in saliva, vaginal secretion and semen, but it won't cause transmission effectively. Blood is the main culprit here. Resistant, readily destroyed by sodium hypochlorite. Why? That's why if any blood spill in the flow, we use in hospital we use sodium hypochlorite to sterilize the area. High risk group. Who are all the high risk group? People from endemic region, babies of mother with chronic HBV, hepatitis B virus, intravenous drug abuser, IV drug abusers, that syringe things, people with multiple sex partners, hemophilias and other patients representing blood products before it was like transfusion and blood bank blood வாங்கி போறோம். Before it was like hepatitis வந்துச்சு. ஆனா இப்போ I think so it's not happening because every time you donate they will screen for the common viruses, that significant viruses. They have the card, they will screen and then they will store the blood. If it's positive, they will discard the blood right away. No one will do the such things. And healthcare personnel who have contact with blood, like me, nurses, and everyone. So patients who are immunocompromised in the sense of who are getting treatment for chemotherapy, and patient who is suffering from HIV/AIDS and TB may have a risk getting this effect. Talking about this virus, it was giving so much of pain because these group of people comes to hospital with complaints of long-standing right-sided upper abdominal pain, where here is the liver. So they peculiarly say that my pain is from right upper quadrant, and they will come only when they got jaundice. Some people won't come when they got jaundice. They will come after weight loss and everything happened. They have no idea that they are infected with hepatitis B virus. So only after admitted in hospital, they get to know that they are having hepatitis B virus. It was a very simple test. It will take 10 to 15 seconds to conclude whether you have hepatitis B or not. it is not a diagnostic test, it was a screening test. So in that only we can get to know whether we are having hepatitis B virus or not. Later scan result revealed hepatocellular carcinoma, that we can't do anything. At the stage of hepatocellular carcinoma, the cancer spread already to lungs and other parts of the body. Only we will watch the patient suffering from pain and they will die in front of our eyes one day, even though whatever the treatment we provide. So it is very pertinent, very important that when for us, our parents will, or their parents are there, parents will get us to nearest doctor as soon as possible when you have fever, cough and everything. These people, who are these people who are coming up late stage are very old age people, the people who are separated from their daughters and sons and family, living alone. Basically, they don't have any caretaker. So, why I am still insisting on you about these symptoms is, when in your home, who is undergoing any upper abdominal pain, jaundice, don't take it as very lightly. Just go and check with the doctor. So you can detect anything earlier and get treatment and will be cured. If those patients seek very attention at early stages of symptom, they will have been treated. You know, some people will come, sir, I have mancharamala. நான் வெளியில் சாப்பிட்டேன், பக்கத்து வீட்டுக்காரனும் வெளியே சாப்பிட்டேன், அவனுக்கு ஒரு மாதத்துக்கு முன்னாடி வந்து நிறைய போச்சு, நான் சும்மா பார்த்துட்டு போகலான்னு வந்தேன். ஸோ வாட் ஐ டூ இஸ் ஐ வில் ரைட் ஒன் டெஸ்ட் ஃபார் ஸ்க்ரீனிங் whether you have hepatitis B or not. So what patient will do? They won't take the test. They will get symptomatic paracetamol and everything. They will go home and they will gossip. And then after the bone, they will have a test. Next time after bone, he will do such a good thing for me. So that same guy will come later with hepatitis chronic infection. So it was a very simple test. Like earlier ma'am said that the doctor வந்து வேர்ல்டு மேப்பே வாசிட்டாங்க அப்படின்ட்டு. It's not the doctors willing to draw world map in abdomen. What he did is best to her health. Okay. So that patient will go and eat Genesil and sleep. This incubation period is 45 to 180 days. That's why even though we are exposed to that virus, it will take days to give the first symptoms in our body. Mode of transmission is mainly in blood, that is parenteral. IV abusers, care workers like who are working in hospitals, and this also can be transmitted through sexual intercourse. And perinatally, mother who is having HBV will give the HBV to her fetus, I mean son or daughter. So it can be avoided by getting vaccination at the birth. That's why Government of India introduced the national immunization schedule, that everyone should get these immunizations. And how do you prevent HBV? HBV is simply prevented by vaccination. And vanduche earlier நம்ம வந்து ட்ரீட் பண்ணிடலாம், பட் லேட் ஸ்டேஜில் இட் இஸ் டஃப். பட் வரத்துக்கு முன்னாடியே பார்க்குறது தான் தலை சிறந்து. ஸோ there is a vaccination, everyone got the vaccination. This way you should get the booster. So if exposed, ஐயோ blood பட்டுச்சு, ஹெப்படைட்டிஸ் பி என் ஃப்ரெண்டு தெரியாமல் பிளட் பட்டுச்சு என் மேலே, நான் என்ன பண்ணுவேன், எனக்கு வந்துடும், அவ்வளோதான் நான் சாப்பிட போகிறேன், அப்படிலாம் கிடையாது. Within 48 hours we have immunoglobulins that can be treated, even though that the hepatitis, even though you are exposed to the virus, we still have immunoglobulins. Other measures, screening of blood donors, blood bodily fluids, everything we have to screen before we are giving to somebody else. Okay, this is hepatitis B vaccination I am talking about at birth. You will get the IM at the anterolateral side of the thigh. That should be taken at 6, 10, 14 weeks. You all already got, and now you should get a booster, and that's all for hepatitis B. Okay, let's go to hepatitis C. It is a asymptomatic chronic infection which leads to cirrhosis. Only B and C are very dangerous. B is notorious. D வந்து rowdy, C வந்து அதோட right hand. So C வந்து chronic infection காஸ் பண்ணும் liver cirrhosis. Liver cirrhosis னா என்ன? What is liver cirrhosis? You all know how to drive a bicycle, right? Speak to me. You all know, right? Okay. யாரும் கீழே விழாமல் கற்றுருந்துருக்கீங்களா? எல்லாரும் கீழே விழுந்திருப்போம். We got scratch. So also we got laceration. தையல் போடுற அளவுக்கு அடிபட்டுக்கலாம். ஸோ நம்ம தையல் போட்டாலும் அந்த இடத்துல ஒரு பெரிய அடி இருந்தாலும் what will cause after healing? என்ன அந்த இடமா ஆகும்? கல்வாகும், ஸ்காரிங் ஆகும். Cirrhosis nothing. After infection, liver tissue scarring ஆகும். செல்ஸ் எல்லாம் டேமேஜ் ஆகி செல்ஸ் எல்லாம் ஃபங்க்ஷனலாக இல்லாமல் ஸ்காரிங் ஆகி லிவர் சுருங்கிடும். அதுதான் சிரோசிஸ். இந்த ஹெப்படைட்டிஸ் சி வைரஸ் இந்தியாவில் அதிகமாக இருக்குது. இதோட சிம்டம்ஸ்லாம் பார்த்திங்கன்னா ரொம்ப வேக் சிம்டம்ஸ். நம்ம யூஸ்வலாக ஃப்ளூ வைரஸோட சிம்டம்ஸ்லாம் இந்த இருக்கும். ஃபீவர், ஹெட்டேக், ஜெனரல் ஸ்டிஃப்னஸ், அனோரெக்சியா. ஹெப்படைட்டிஸ் பியோடது அப்படியே இருக்குது. நாசியா, வாமிட்டிங், டார்க் ஜாண்டிஸ், எவ்ரிதிங். Incubation period is 40 to 120 days like other hepatitis virus. Mode of transmission is through blood only, and blood transfusion, blood products. This one C virus is what we can say persons who are going hemodialysis should have to be screened for hepatitis C virus every 3 months or after every phases are done. Because it was very prevalent in hemodialysis patient. Why? We don't know. Let's say I am having hepatitis C virus, I am going hemodialysis. There is a machine which will dialysis my blood, and it will do the kidney work. If my kidney fail, I will go for dialysis. I have hepatitis C virus. That C virus will stay in the machine. Okay. Next person will come. But unfortunately, he doesn't have hepatitis virus, and after dialysis he will get hepatitis C virus. That's how it will transmitted, and through checking on household exposure and vertical transmission. This will also mother to baby transmission occurs. Prevention. Unfortunately, there is no vaccination for hepatitis C virus. Only general prophylaxis. We have to screen everything. So no specific active or passive immunization agent against available yet, not yet available for use. So treatment is, there are 2 types of treatment available, like interferon we can treat the chronic hepatitis, ribavirin we can treat. So that's all for hepatitis C. Now we are moving to hepatitis B. Hepatitis B also classified as delta virus. We all have one mischievous virus. நமக்கு ஒரு ஃப்ரெண்டு குரூப் இருக்கும். அந்த குரூப்பில் சேட்டை பிடிச்ச ஒரு ஃப்ரெண்டு கண்டிப்பாக இருப்பாங்கல்ல? ஓகே, இருப்பாங்களா இல்லையா? அந்த குரூப் ஆஃப் ஃப்ரெண்டு ஒரு 3 people இருந்தாலே அது ஒரு சேட்டை பிடிச்ச ஃப்ரெண்டு கண்டிப்பாக இருப்பாங்க. இல்லை எல்லாருமே சேட்டை பிடிச்சவங்க இருப்பாங்க. யாராச்சும் ஒரு தான் கண்டிப்பாக இருப்பாங்க. இன்னும் 2 பேர் அமைதியாக இருப்பாங்க. ஆனால் அந்த 2 பேரில் ஒருத்தவங்க மட்டும் டார்மன் ஸ்டேட்டில் இருக்கும். டார்மன் ஸ்டேட்னா என்ன? நல்ல ஸ்லீப்பர் செல் மாதிரி இருக்காங்க. எப்போ அவங்க ஆக்டிவேட் ஆவாங்கன்னா அந்த மூணாவது மிஸ்டீவியஸ் ஃப்ரெண்டு அவங்க சேட்டை பண்ணும்போது இவங்களும் சேட்டை பண்ணுவாங்க. அவங்க இல்லாத போது நல்ல பிள்ளையா நல்ல பேர் வாங்கிட்டு எழுதுவாங்க. ஸோ அந்த மாதிரி ஒரு வைரஸ் தான் ஹெப்பாடைட்டிஸ் பி வைரஸ். We all have one mischievous friend in a group who do naughty things in class. We also have friend in the same group who only do mischievous things when other mischievous friend present. Do you know why? ஏன்னா எல்லா பழைய தூக்கி அந்த ஃப்ரெண்டுகளை போட்டுருக்காங்க. நான் நல்லா இல்லை, இவன் தான் எனக்கு எடுத்துட்டான். ஓகே, இல்லைன்னா நான் விட்டுருப்பேன். ஓகே, ஸோ ஹெப்பாடைட்டிஸ் பி வைரஸ், hepatitis B virus, it is a subvirus active. It can only propagate in the presence of hepatitis B virus. B virus இருந்தா மட்டும்தான் D வந்து propagate ஆகும். D இல்லைன்னா D propagate ஆகும். So mode of transmission is similar to hepatitis B virus. Blood transmission na incubation 2 to 12 weeks. So we are coming to hepatitis E. What public concern, நம்ம ஹைஜீன் பற்றி கன்சர்ன் பண்ணுறதுக்கு ரெண்டே வைரஸ் வந்து A and E. எதுக்கு கன்சர்ன் பண்ணணும்னா, பட் A, E we have to more focus on because it can be present in street food. We don't know which street food, which கடை, which gentleman. So hepatitis E is a viral hepatitis. இதுவும் அக்யூட் சர்க்குலேட்டிங் இன்ஃபெக்ஷன்னா இதுக்கு ட்ரீட்மெண்ட் எதுவும் தேவையில்லை. ட்ரீட்மெண்ட் தேவைன்னா சப்போர்ட்டிவ் ட்ரீட்மெண்ட் நீடட். அதுக்கு வீட்டிலே இருக்கக்கூடாது. சப்போர்ட்டிவ் ட்ரீட்மெண்ட் ஃப்ளூயிட்ஸு மற்ற இதெல்லாம் நம்ம வந்து எடுத்துக்கிறோம். இன் high risk group like already I told about the persons who going under chemotherapy, they are immunocompromised, they will develop chronic hepatitis. It occasionally causes acute severe liver disease. In pregnant women, this disease is more often severe and is associated with a clinical syndrome called fulminant hepatic failure. If pregnant woman hepatitis E virus வந்துச்சு அப்படின்னா her state in a state, every nutrition is going to her baby. She doesn't have any nutrition left to fight the virus. So clinical syndrome காஸ் பண்ணி சடனான ஹெப்பாட்டிக் ஃபெயிலியர் நமக்கு வந்து டிரான்ஸ்பிளான்ட் தேவைப்படுற அளவுக்கு இது வந்து காஸ் பண்ணும். சேம் சிம்டம் அனோரெக்சியா, நாசியா, ஜாண்டிஸ், vomiting, everything, they are same presentation. It is spread mainly by fecal overload like hepatitis. Which virus? Like hepatitis. Mode of transmission of hepatitis E virus is similar to which virus? Very good, A virus. Everyone is not sleeping, I hope. Okay. Person to person transmission like articles, saliva, இதுலேயே transmit ஆகுது, ரொம்ப ரேர் இது. இதை எப்படி ப்ரிவென்ட் பண்ணலாம்? How do you prevent this? Avoid drinking water of unknown purity, uncooked shellfish is not widely available, but if you are going to a top restaurant, if you order shellfish, you should always be in mind it should be cooked. Don't order medium rare, always order well done. And fruit vegetables not being prepared by travelers. Okay, it was a heck of a boring lecture on viral hepatitis, right? For me also it was very boring. I slept in my class when I was doing UG in viral hepatitis also like this, like same like this. I was in last bench, so when professor watched me, I was like this. She thought I was listening, but my eye was closed. Same things I think some of you are doing, right? Okay, let's talk about some interesting facts and real awareness. So not only hepatitis virus causes hepatitis, there are so many things which causes hepatitis, inflammation of liver. So we will be talking more on those things because nowadays after COVID, everyone is using social media. Everyone is believing what you are seeing, what you are hearing from social media. The facts which is circulating in social media, unfortunately, major facts unfortunately are unverified or not by health practitioners. So we will see what is human liver looks like. You can see a human liver. This is human liver. This was taken by me. That one you are seeing. That's how liver is inside your body. So in right side for your side, right side. You see in right side there is a complex vessels are going inside the liver. You can approach that one system from downside. The vessels coming from intestine, right? The other going to somewhere else. We don't bother where it is going. So what I am saying is, whatever you eat is going to the intestine. It absorbs into the bloodstream through intestinal blood vessels. The blood vessels directly go into the liver. Okay. Whatever you eat, it get digested. It will transform into absorbable forms. It will absorb into the blood. It will directly go into where? Liver. You ever wonder what is the function of liver? We'll talk about it later. Normal liver span, that is liver size is 6 to 12 centimeter. Liver is the only organ in human body apart from epithelial and some other tissues which have repair capacity and regenerative capacity. Whatever insult, not the verbal insult, right? Whatever the insult you are doing to hepatic cells, it can regenerate, it can repair itself if you give proper time. Okay, we can divide the liver into various segments, 5 segments. So some of the functions of liver: it controls carbohydrate and fat and protein metabolism, convert glucose into glycogen and stores it. Zoology students, you already know what liver does, TCA cycle and every cycles, lot of cycles, right? Liver is doing urea cycle and everything. Okay, protein and cholesterol with synthesis, vitals, proteins and blood clotting factors. Blood clotting factors, whoever having liver damage or liver disease are prone to bleeding. அவங்களுக்கு என்ன பிரச்சனை இருக்கும், லிவர் பிரச்சனை இருக்கும் அப்படின்னா கட் பண்ணிட்டாங்கன்னா பிளட் போயிட்டே இருக்கும், பிளட் நிற்காது. காரணம் liver is damaged, it can't produce clotting factors. It synthesis protein and cholesterol and it synthesis bile which is green in color, gallbladder போய் அது டைஜஷனுக்கு ஹெல்ப் பண்ணும், எஸ்பெஷலி ஃபேட் டைஜஷன். Stores vitamin A, D, E, K and B12. You should go take a note. A, D, E, K, B12 in assisting in their metabolism and activation. blood conversion. It produces and detoxifies hormone, not only hormones, it detoxifies blood. What it does? Detox. Have you ever heard detox? Detoxing as a detox. Detoxification. Nachinikum. Yes, nachinikum. Have you heard of it? Detoxification panaboda. Ever friend fitness freak ever said that I am going to detoxify my body? Never? Okay. For you I have so many slides after that. Okay. Basically it detoxifies the system, blood systems, and it converts thyroid and sex hormones into active and inactive forms. It metabolizes drugs, whatever you are eating, like paracetamol, 650 bota patta, whatever you are eating, it goes to liver first, it will get activated. Whatever you overdose, liver will try to metabolize, if not, it will damage. So that's how everything is working. Liver is doing everything functionally. So functions of liver is there are 500 plus function, mainly metabolism, nutrition, detoxified blood, produces bile for fat digestion, stores glycogens, ions and vitamins, synthesizes proteins, especially clotting factors, filters pathogen from bloodstream. Okay, when will you know your liver is affected? Every person who is infected with viral hepatitis, any A, B, C, D, E, whatever the letter is apparently healthy. Majority of the patients, majority of the person, but are found that they are having hepatitis incidentally, that they are going to foreign, they have to do a master checkup, that they are going in all India tour, that we have to give a medical report. That time we are incidentally finding something. So why liver damage or we can't know that liver is damaged? If you have cataract in your eye, you don't have vision, blurring will be there. If you have a heart attack, chest pain will be there. If you have COVID, right after the infection, everything will happen. For heart attack, you have chest pain. COVID, you have cold, flu, breathlessness, flu-like symptoms, cold, and everything, fevers, and everything will come. For this, when liver is affected, we won't get to know instantly. We get to know after 3 to 4 weeks. How? Manjarama, jaundice. Here I am seeing some of the persons who will get my 500. So I will only have 500. So make sure that you will get. Okay. You will get to know only after 50% of your liver gone. 100% of your liver already gone. It is irreversible. It may be it will regenerate according to what you had. So you will get to know after 50% of your liver gone. Who can get liver disease? Liver disease. Liver body. So guess I am looking for that answer. Whoever said alcohol, I appreciate you. Okay. Only people look like this will get, you are saying that only people who look like this will get liver disease. And next, like these people only get liver disease. Who consume? What they are doing? They are consuming alcohol in a group. That's what men do. They won't do anything alone. They always want support, emotional support and everything. They will do everything, every nuisance in group. That's how they are going to spoil their liver. Only people look like this will get. You think they will get? Only people look like this will get liver disease? Is it? It's not true. People may look like this will get liver disease. You know this guy, right? Actually, he's selling what? Sofa. His famous was selling sofa. He's helping his dad's furniture store. Okay. Why I am showing this? And you may correlate with the next picture. People who look like this may get liver disease. What is the link between those two? Apart from the very good. Who said that? Clap for me. I was looking for the answer, white skin. Okay, unfortunately I didn't get that answer. Okay, they are white. Apart from that white, they are fat. Why being fat causes liver disease? See, before, being fat is very lovely in our homes. Your mom will adore you, your father will adore you. That being fat, it was like a family trait that my son or daughter is chubby because they are very nourished and they are very having all what your mom said. If you are lean, சாப்பிடவே மாட்டேங்கிறான் எங்கே சத்து வரக்கூடாது. That's what every mother's dialogue is. Contradictorily, being fat doesn't mean that you have all the nourishment and everything. Being fat may causes liver disease. How? That type of liver disease is known as non-alcoholic liver disease, fatty liver disease. Non-alcoholic fatty liver disease. I am not fond of talking alcoholic liver disease, which is apparently one day they will get those who are a chronic drinker. One day they will die. There is no use of talking about them, in my opinion. Okay, so non-alcoholic fatty liver disease is nothing but a simple fatty liver. Whatever you eat, it will store in your skin, under the skin. Fat tissues are there. It will store, and also the fat is stored in your liver. Later, if you are exploring the Sahara Desert, and if you are exploring, some of you are maybe will go Arabic countries and exploring deserts there. And what if you get lost without anything, without food, without water for 2 to 3 days? What will you do? If you are fat, or if you have adequate fat in liver, that fat will converted back into glucose and it will utilize as an energy. So that's how you will survive in desert with or without food. So this is a simple fatty liver, also called steatosis. It is the first sign of accumulation which can be reversed. At this stage, fatty liver, every one of us in this hall have fatty liver, irrespective of their body weight. Every one of us, even though you lean, even though you fat, even though you overweight, you might have fatty liver. I will explain why that we have fatty liver. First, at this stage it is reversible, and then the next stage is a non-alcoholic steatohepatitis. So this short term is NASH, occurs when the liver start to get inflamed. The fatty liver inflamed NASH. Respond to over accumulation of fat cells. already our liver is already crying out of our sedentary life, eating biryani at 12 a.m. and eating everything whenever we want, taking highly fat foods and at late times will cause fat accumulation over time. Responding to over accumulation of fat inside or around, at this stage it is reversible. NASH, first என்ன பார்த்தோம் simple fatty liver, அது reversible. அடுத்து NASH inflame ஆச்சுன்னா NASH போகும், NASH போச்சுன்னா அது reversible. Fibrosis is nothing but a scarring. இப்போ தான் ஸ்கார் ஆக ஸ்டார்ட் ஆகுது. ஸோ ஒரு கட்டத்துக்கு மேலே ஹெப்பாட்டிக் செல்லால் ஸ்டோர் பண்ண முடியாது. அது என்ன பண்ணும்? வெடிச்சிடும். சிம்பிளி வெடிச்சிடுவாங்க. வெடிச்சிச்சுன்னா அது என்ன ஆகும்? ஹீல் ஆக ஆரம்பிச்சிச்சுன்னா நம்ம அதர் ஹீல் செல்ஸ் எல்லாம் போய் அந்த அதை ஹீல் பண்ணும்போது it will heal by fibrosis. That's how tissues will heal. The gradual process of the liver cells getting destroyed, thin bands of scar tissue start to build up, reducing blood flow through the liver and limiting its access to oxygen. Scar tissue la blood vessel irukka, adu taandi blood போகாது. என்ன பண்ணுவாங்க? ஃபைப்ரோசிஸ் ஆன டிஷ்யூ என்ன தாண்டி நீ போய் வர அப்படின்னு சொல்லி ஹீமோக்ளோபின் சொல்லுவோம். ஆக்சிஜன் கொடுக்குற ஹீமோக்ளோபின் சொல்லுவோம். அப்பரண்ட்லி ஹீமோக்ளோபின் இஸ் ஹெல்ப்லெஸ். There in another universe, there that scar tissue is a Muthubandi, that hemoglobin is a Vijay. What is his name? Velu in the flame. Okay, he can't do anything in that because that scar tissue Muthubandi is overpowered there. He can't beat that guy and take the Trisha away. So cirrhosis is the final stage. That fibrosis, that at single place the fibrosis happen, we say it's fibrosis. Throughout the liver tissue, the fibrosis happen, it will become cirrhosis. The liver size will shrink. Left untreated, the liver can get severe permanent scarring. It then does not have enough healthy cells and can no longer regenerate. Eventually, it may lead to liver failure. Cirrhosis mantale, it will lead to liver failure. Anyone having a family friend or a known person who is having liver disease? Anyone know their agony, pain and everything? Okay, that's good. Okay, we all have simple fatty liver, but Caucasian and other ethnicity people not usually don't have. Caucasian people have. Any cases Caucasians, Asians தெரியும், அது என்ன Caucasians? Okay, Caucasians are British people. Simply they are from Britain and surrounding areas. We call the British people as Caucasians. And other ethnicity peoples at Europe countries, they don't usually have fatty liver. Do you know why? Why we only have fatty liver? They don't have fatty livers because they are Western peoples. They have readily access to hospitals, and they are developed countries. They have very brilliant healthcare systems. Are you thinking like that? Are we in the same track? நமக்கு எல்லாருக்கும் fatty liver disease இருக்குது. ஆனால் British people, Western peopleஸ்க்கு ஏன் இல்லை? அவங்க ஹெல்த்கேர் சிஸ்டம் ரொம்ப அவேர்னஸ் சிஸ்டமா அதனால இல்லையா? No, I will show why we have fatty liver disease. It's because our genetics. What genetics? You see the Madras Great Famine of 1876 and 78. You can see those precious babies who are holding their child in hand, who are very malnourished. Their bones are visible in naked eye. The one lady is trying to feed her child. Unfortunately, she can't produce any milk in that time. This famine happened because of who? Any history people here? Did anyone get to know this before? And I am the one showing Is it new for you? Seeing this picture? You already seen it? No. Okay then. So this is an era of British Empire. It was a man-made famine. It was not naturally we have droughts. We don't have water management and anything that in those kind of eras. We do have water management in the Tanjavur and Trichy deltas because of some of our kings do good about those things. In Madras Pattam or Madras Presidency, there is a great famine in 1876 and people are looking like this and this also. They are not dead. They are not dead. They are living people who can speak badly and who can move badly. What they are wearing in here is their thali. These people are you can see the bones and everything, skulls, and some of them can't even get up. This kind of horrific things happen. And these photos, you can observe that two ladies and one child is in the floor. There are three of them in the floor. One is sitting with a stick. Do you know why that man is sitting with a stick? Those times don't have food, they don't have anything to eat. What they started, they become zombies. Not real zombies, but they have to feed their family, right? Even if I were there, if I see my mother or my brother, my sisters are suffering like this, I want to feed them. My inner eyes want to feed them. What ultimately leads to is cannibalism. What is cannibalism? Man eating man, human eating human. That is cannibalism. That same species eating same species. So that was emerging cannibalism time. This gentleman is protecting his family from those cannibalistic people. Cannibalism is the only choice to live those days. Maybe this man got his, maybe he is got his family with stick from those cannibalistic people. Okay, let's come back to the non-alcoholic fatty liver disease in India. It was said that it was more prevalent, contribute to larger burden in the world, especially in India, because it was emerging nowadays. It was emerging. People are getting liver disease who are already having fatty liver, and I have seen some cases also. The entity of non-alcoholic fatty liver disease comprises a spectrum from simple steatosis to non-alcoholic steatosis, that is NASH. Inflammation. When you don't have inflammation, that is very simple fatty. That when you have inflammation, that is NASH. The NASH will progress into fibrosis. This is a common, nowadays it is a common indication for liver transplant. When you see, you know we have a transplant ledger for every state in India. We have transplant ledger. If you have any if you want any organ, like you want kidneys, you want liver, you have to go and enroll in the ledger. That ledger will give. That ledger contains so many people who wants organs. When organ is available, some people, let's say some gentleman died in a road accident, or some gentleman became brain dead. His organ will harvested and given to the people in the ledger. So I think the time is getting late. I will make it fast because more entertainment at the last. This is how the liver is progressing. Healthy liver, non-alcoholic fatty liver disease, NASH liver is look like this. The first one you are seeing is a healthy, completely healthy liver. That image you remember I have put it in the beginning of the liver topic. That is slightly deposited, fat deposited, and this is NASH. It is slightly inflamed. You can see the red spots, occasional red spot, and this is a end-stage liver disease. End-stage liver disease, you can see everywhere it's inflamed, and then fibrosis is there. Okay, I have told that I have told by my colleague that we need to face doctors need to face a new entity, new thing, brand new headache for doctors. What is that? Instagram influencers on health. Everyone is I know everyone is doing skincare by watching Instagram and buying skincare product by watching Instagram, isn't it? Right? If you say no, then it is yes only. I know. Okay. So Instagram influencers, they talk about health. Whatever product they are using for skin, they will market. They will ask to buy from the link, so they can earn and they will close from that. The same thing happening in health. Do this, drink this, eat this, and go here and get some medication here like that. Who is she? Oh, very instant response. I was wondered. Okay, she is Ramana, right? What she did, like 6 months ago, what she did is someone slammed over social media for advocating hydrogen peroxide. Hydrogen peroxide is it's a medicine which we use for disinfection and also use for cleaning wounds. இப்படி சொன்னா புரியுங்க. நொரப்பொங்கல் மருந்து நிறைய தெரியும். புண்ணுக்கு நொரப்பொங்கல் மருந்து. Right, very good. ஒரு one person already know that மருந்தை inhaler nebulization பண்ணுவாங்க. சிவப்படி பேஷண்ட்லாம் nebulization பண்ணுறாங்க. அதில் ஊற்றி குடிச்சா உடம்பு நல்லது அப்படின்னு சொல்லி அட்வொகேட் பண்ணாங்க எங்கே ட்விட்டர். She was slammed by doctors all over India. One of the prominent doctors' name was Liver Doc. He is Liver Doc. His Twitter profile is Liver Doc. He is from Kochi. He slammed Samantha very much for advocating this kind of procedure. What happened if you inhale? If we use hydrogen peroxide nebulization, in the right side picture, you can see that she is inhaling that thing. I don't know whether she is really doing that or doing it for Twitter. So hydrogen peroxide nebulization is a pseudo-scientific gimmick proven to cause chemical pneumonitis and may cause liver damage. It will definitely damage your lungs, and further it will extend to your liver and damage your liver. So this is what that liver doc said. He was actively fighting all pseudo-scientific things which is coming in the social media, and there is a red picture that was given by Asthma and Allergy Foundation of America. She has a heck of followers. Samantha has how many followers? She is having millions, not only in India, all over the world. So her influence is how much? Like that. Samanthaவோட influence எப்படி இருக்குன்னா, ஒரு ஆஸ்மா அண்ட் அலர்ஜி ஃபவுண்டேஷன் ஆஃப் அமெரிக்காவே தானாகவே கொண்டு வந்து ஒரு நோட்டிஃபிகேஷன் வெளியிடுது. So that much important is influences having in the society regarding these health related tricks and tips. So they say do not put hydrogen peroxide into your nebulizer and breathe it in. This is dangerous. It's not a way to prevent or treat COVID-19. Okay, so you can see that 2 weeks before, one teenage boy, 17 years old boy from Tamil Nadu, from Kanyakumari. He died. Upon examination, he was found that he is in weight loss diet. What he did is, he blindly followed some YouTubers' advice. You already see this in, I will take only 5 minutes, 10 minutes. Don't be fast. Okay? 5 minutes. Okay. He blindly followed YouTube advice and he took only juices and diet inspired by the YouTube. What happened to him is he died. He He not even admitted, he died at the instant. Say the turmeric pills that now it was in trend, it essentially poisoned liver. Those who took Indian American in America took this kind of pills and she was saved by early intervention. This is the cirrhotic liver. How it looks like after everything. So follow this party, follow this grandmother to detox your liver in 7 days. What will happen? She will outlive for 100. She will outlive for 100 years. She will die in 2 years only. You can't see. She will do every videos after you die. Okay. The same. This is when it comes to the points. If anyone have a bodybuilding brother, either elder brother or younger brother, definitely he will have this protein powder in home. நீங்கள் என்ன பண்ணணும், இதை தூக்கிறதுக்கே சாப்பிடணும், அந்த அளவுக்கு வெயிட்டாக இருக்கும். இந்த ப்ரோட்டீன் பவுடரில் that we did a research that on NGO did a research that they found unwanted substance in the protein powder. They found high heavy metals in the protein which can cause liver damage and kidney damage, and essentially they have to transplant. This ensure diabetes, they ensure high protein. Ever heard of anyone in your home taking this kind of protein? It was high in taurine level. It was not recommended by the researchers because it was a famous brand. Even my neighbor was taking this powder for diabetes control. Okay. We are saying that this is the engine of a Porsche we call engine. This is a locomotive train, diesel engine. I can say that our engine is liver. I know some of our have objection because how come liver can be engine? Heart is the only engine, right? Oh, okay. So why I say liver is the engine? Only 2 or 3 states are left. If heart fails, we can put a pacemaker. With a machine, we can replace it with a machine with a pacemaker. If lungs fail, we can put it with a ventilator and ECMO. We can put a machine in the place of lungs. We can put a machine in the place of kidney for hemodialysis. And liver fails, we don't have any machine. We should get functional compatible liver from someone to donate so we can live longer. This is a simple test kit, will save so much of so many liver transplant. So be tested and be knowledgeable and prevent hepatitis and be a well-known person. Thank you. Okay, coming to the point, my quiz question is, what is the name of the doctor?
Madhu Balan.
It's not name. Today is July 28th. Whose birthday is? Come on. Okay, very good. What's your name? Huh? Egmania. Okay, she got the 90% answer right. Gorge Bloger. Okay, I'm going to hand over this 500 to her. Please come to the stage. Okay, what's the first thing she will do with the 500? She will go to the Pani Puri Wala and get